Do you remember the film Gaslight?
Yeah.
I feel like we're being gaslighted. You know, I feel like there's like, why are they doing this? I mean, can anybody help me understand? Why is this happening?
There must be money in somebody's pocket.
Yeah. I've got some I can say some of the things that are going on in that. And definitely the economic considerations are big time. You're talking billions and billions of dollars on the line. And, you know, because the FDA, you know, gets information from the drug companies, and they're protective. FDA agents and administrators go to work for the drug companies, and drug company employees go to work for the FDA. So there's a revolving door policy there. But I think that fundamentally, most of the people at the FDA are not deliberately trying to take advantage of the American populace in defending the drug companies. I think they're all well-intentioned people, most of the people at the FDA. They just have an outmoded worldview that you get all your dietary needs in your food, and that supplementation is fundamentally fraud and worthless. You're just enriching the sewer, and therefore anything they can do to stop you from spending your money on vitamins is doing you a favor.
Excuse me, did you mean they think that we get enough vitamins in our food? Where do they eat?
You should see the FDA's cafeteria.
I take other supplements too, minerals and herbs, things like that. Not always, not every day, but on a fairly regular basis, in conjunction, you know, with eating right and exercising. But
do you know anything about what's happening in Washington and Congress right now concerning this?
Yes, it's very disturbing. They basically want to take vitamins off the shelves in your markets or your health food stores or your vitamin stores and make them only prescription. And I don't know if the FDA is going to decide which vitamins they feel are valid, which ones they feel perhaps are not valid. But I think that people do need to be educated. I think that it's not like anything else, just to take handfuls of vitamins and not really understand what they're doing, what effect they're having on you, isn't the best way. And I don't know what the data is if people ever maybe getting bad side effects. I mean, that could be, you know, I haven't heard anyone getting toxic from vitamins.
Would you be very upset if I told you would have to get a prescription for your vitamins henceforth?
It would be terrible. And I think a lot of people who use vitamins feel that this is just a way for the FDA to basically cash in on a market that is really very lucrative in this country. And I think what's happening, it's more than, I hate to make it sound like it's a money-making thing for people in vitamins, even though, you know, we live in a capitalist country. But I think that what's happening is, especially here we see it in LA, is people are starting to take more control of their health. I think because of the AIDS situation and other terrible diseases that we've seen and other things happening in our society and the smog and what else, I think people are trying to get a better control over their health, whether it's working out, taking supplements, eating better, being more aware of what goes into your bodies. So I think, if anything, we need to help people become more educated about vitamins, minerals, herbs, and also prescription drugs, because I do think that prescription drugs have their place in healthcare. But I certainly think that it would be a great tragedy to remove vitamins and minerals, etc., from the general public, because once again, it'll be a situation where people may not be able to afford the medication. It means you'll have to go to a doctor to get a prescription for something that you can very well, in many times, handle yourself.
What would you think about just putting a labeling on the bottle?
Very good. I think that's very good, and I think also more literature. I think when you go to buy the vitamins, perhaps have some kind of flyer or literature telling you what the vitamin is for, what it's composed of, or the mineral, in what cases would you use it. Also, proper dosage, so you don't overtake these things, you know, or maybe, you know, I don't know what things could happen to people. I mean, I've been lucky; it's never happened to me. But I'm fairly conservative. When I don't take them every day. I take supplements maybe 3 times a week, and then a little extra if I'm under stress or not feeling well. But most people I know, like I say, have not had any problems. But I think we have to be educated, and I think that if the FDA wants to help educate people and work with the people who are making the vitamins and making the supplements, etc., work hand in hand to better inform everyone for preventative medicine as well as everything else, I think everyone will be happy, and it's not going to hurt anyone, because the bottom line is there might be times when you have to go to the doctor and get that prescription. But I think all medical people should want healthy people around. So.
And I agree with you. Thank you so much.
Thank you. A little long-winded, but it's a real serious subject, I think.
And I'm here because I'm a concerned citizen. But one of the questions that I have, you have all given points of view that are very scholarly and very educated, and from a medical point of view. For someone like myself, it's very interesting, but a lot of it has been a little confusing. And the question that I would like to ask, perhaps as an audience would like to ask, is I don't think that people know their rights are being infringed upon. I don't think they're informed enough yet to know that tomorrow their rights are being infringed upon. I have friends that take vitamins every day. They don't look at the labels. They don't realize what's at stake. They're not informed. And these are bright people. These are educated people. These are people that go to work, that have children, that have husbands, that are professionals, that care about their communities. They care about themselves. So how do you, as those who are the most informed really about this issue, intend to inform people like myself?
Well, that's a very good point that you bring up, Kate. Not only do I have a concern as a patient, I have great concern, as all journalists or people who are interested in the truth should have, because what they are reading in the papers and hearing on television may not be the true story. And it is not an industry issue. This is not the supplements industry wanting to manufacture colored water that doesn't help anybody. Yes, there are those people in there, like there are unethical doctors or unethical politicians or businessmen. This is a consumer issue, and it's very difficult.
Do you think that's the answer, Kathleen? Because I'm going to ask a couple of you. Do you think that's
Susan, I think it's absolutely very, very important that people in the public hear the story of what these supplements can do, what these issues are, what's happening. You know, I grew up in Washington. If you don't live in Washington, California or other parts of the country seem very far away, and things happen very quickly. It goes through the Congress, and we have to be aware of that. And I've been actively spending every waking moment of my life trying to find the information, and it's still very difficult. So imagine for the average person if they're not getting it on the radio or they're not getting it in the newspapers or television. It's very necessary.
I think it's necessary too, but I'm supposed to be the devil's advocate here. You know, and this is not a California or Washington issue. This is the Bible Belt. This is Iowa, Nebraska, Missouri, Kansas. This goes right across America, folks. This is not just because Californians like vitamins. I have to point that out. Would you like to go? Because there's so many things we want to cover here. Go ahead and cover it.
I'd like to have Steve or Russ just give you a little bit of an update on what, you know, where it stands, why we're all here, what the emergency is here, what's going to happen, what the scenario is, and what we can do about it. Okay. So I'm going to defer to maybe Steve. You'd like to start.
Okay. The FDA has basically taken a congressional act, the Nutrition Labeling and Education Act, and written regulations for it that instead of expanding claims are going to restrict them severely. And this is so draconian as to possibly result in the elimination of most supplements from the marketplace. Whether this will happen in 2 months or 2 years is really up to what the FDA is going to do with it.
Yes, and they're being very disingenuous about it. They're not really fessing up to it. They've written regulations, they've discussed this, they've had meetings with people, and then they make public statements, no, we don't intend to take vitamins off the market. They're being extremely misleading.
That's what they said to us when we went to meet with them. The first thing out of their mouth was, when we started talking, was, "Oh, we're so glad you're not worried about us taking these things off the market, and what you want to deal with is the safety issues." Which the first thing we asked them were questions about safety, and they said, "We don't have any intention of taking these things off the market." And yet, when we asked them about the specific, you know, regulations involved in the NLEA and how they would be enforced, again and again and again, we came down to prohibition, that they would have to take these things off the marketplace. But it's true that to some extent the FDA is engaging in a very, very powerful and well-orchestrated media campaign to keep Americans from understanding what this issue is. And they are saying, for example, as you mentioned, that this is an industry versus FDA issue, and that this is a matter of greed, and that greed is corrupting the industry, and therefore they can't be trusted to say anything. And as a consumer, I resent that. You know, as a consumer, and just to quote from the Consumer Coalition for Health Choices testimony to the House Subcommittee on Health and Environment, we support safe products, pure ingredients, full potency, manufacturer's standards of identity, nutritional good manufacturing practices, full disclosure labels, and non-misleading claims.
Hear, hear.
And that is the bottom line, and that is what the FDA is trying to stop by, in a sense, misinterpreting the Nutrition Labeling and Education Act legislation.
So